The patient in this case is being transferred from the emergency department, where he presented 6 hours ago with intestinal obstruction. A flat plate of the abdomen showed multiple loops of distended small bowel. In preparation for this procedure, the surgical team is assembling for a pre-operative briefing, guided by a checklist that has been standardized for the general surgery service. The team will go over their checklist for several minutes to discuss the planned surgical procedure, including any needs for equipment, special instruments, blood products, additional personnel, radiographs, intravenous drugs, disposition postoperatively, and any other needs identified by the team for this procedure.
Okay, guys, let's get the preoperative briefing started.
Dr. Albo, shouldn't we step outside to do this? I'm not really sure that it's appropriate for the patient to hear this conversation.
Well, David, I hear your concern, but we've been doing our pre-op briefings in the operating room because we're all here. We also like to have our anesthesiologists and scrub nurses to participate in the discussion. Plus, we also like to have the computer with our preoperative briefing list on it, and as well as the whiteboard so we can record important information.
I agree. In the past couple of years, can anyone remember a patient expressing concern or discomfort about being in the room while we held our pre-op briefing?
Well, actually, I remember some examples of just the opposite. Patients commenting that seeing us have a discussion together, checking various items, gave them some comfort.
Mr. Eldridge, do you have any objection to our discussion about the surgical procedure we have planned for you today?
Okay, you're talking to me, I'm sorry. No, not at all. I'd prefer that you guys agree on what you're going to do before you start this thing.
Okay, thanks. Just checking. So let's get back to our discussion. Rob?
Right. I'll just run through our checklist, starting with our patient. Mr. Noel Eldridge, Social Security number 103662226. Date of birth, April 10th, 1960.
That's correct.
I have the procedure as exploratory laparotomy, lysis of adhesions, and possible small bowel resection.
Yes, that's accurate.
Okay. That's what I have on the IMED consent signed by the patient. Allergies? None. NPO for the last 6 hours since he came into the ER, right?
I agree.
Was the surgical site marked?
The surgical site was marked with Dr. Albo's initials.
Okay. Implants? None?
Actually, Rob, we may use some Ceprafilm at the end of the case.
Okay, I'll have that available. Any special instruments in addition to the laparotomy setup?
None that come to mind, Rob. Actually, I'll take that back. Cindy, do we have bowel clamps and staplers in case we need to do a bowel resection?
Yes, Dr. Albo, we have the bowel clamps on the field, and we have the stapler available.
Terrific.
Laterality is not an issue here. Any images for this case?
Well, Rob, we just looked at his acute abdomen series, and that clearly showed a small bowel obstruction.
Yes, David, I agree.
Any IV antibiotics?
Yes, I just started infusing ertapenem 1 gram a few minutes ago. It should be finished in 15 minutes.
As a matter of fact, this will be the only dose of antibiotic he will need because he maintains an adequate blood level for 24 hours.
What about DVT prophylaxis?
Well, the patient should have sequential compression devices on both legs, Rob, and we should start some sub-Q heparin, but let's wait 12 hours post-op for that.
Okay, right. Attending pre-op note? Yes, I see it. Position, supine? Anesthesia, general?
Yes.
Blood? We have a type and screen, and he has some cold antibodies. Will that be sufficient?
No, I would be more comfortable with 2 units set up for him. It might take a while to find 2 units with his antibody, and his hematocrit is only 30% to start this case. Are you okay with that, Dan?
That's a good idea, Sal. David, would you call the blood bank and ask them to tap and crossing for 2 units of packed red blood cells?
Sure, no problem.
Do we need any special equipment for this case?
Yes, Rob. Let's use the LigaSure. If we have to do a bowel resection, it will help us go faster.
Okay, got it.
Bye.
Anything else?
Nope.
Sal, are we waiting any lab studies before we start?
No, but I will be checking the hemoglobin, hematocrit, electrolytes, and glucose at least once during the case.
Got it. Any special precautions? I see his HIV and Hep C are negative, but his nasal swab for MRSA won't be back until tomorrow.
Yep, no special precautions.
Should he receive a beta blocker?
No, I don't think so. He has no history of either high blood pressure or heart disease. Isn't that correct, Mr. Eldridge?
Yeah, that's right. No, I've never been told I have any heart disease or high blood pressure.
There is nothing in his record about heart disease. I agree he doesn't need a beta blocker.
Will you be needing an insulin infusion for glycemic control?
I doubt it, but I'll have a better idea when we get into the procedure.
Will we have any specimens?
Yes, Cindy, that's always a possibility.
Okay, and what about the C-arm for fluoro?
No, we won't be needing that.
Fine. And about how long do you think we'll be in here? I won't be able to stay late this afternoon. Just wanted to give you a heads up, Dr. Albo.
Well, I appreciate you giving us a heads up, Cindy. I guess it will take a couple hours or so.
And where will he go from here? PACU and to the floor or SICU?
SICU?
Yes, David, let's give the CQ a call. This case is not going to finish until late this afternoon, and I'm really concerned about potential instability issues tonight.
Okay.
Sal, what do you think?
I agree. It's going to be late when we get out of here. And he may need the ventilator for a while post-op.
Okay, thanks a lot, Fran. I really appreciate it. We'll give you a heads-up phone call when we're about 30 minutes from being in the ICU. Rob, they got us a bed. I just need you to remember to call the ICU when we're about 30 minutes from getting over there.
Will do.
Good.
Okay, that covers our checklist. Any questions before we get going?
Yes, Rob. Dr. Berger, how many liters of saline would you like to irrigate the abdominal cavity?
Why don't we get 10 liters and let's warm up half of that saline.
We'll have 5 liters of warm saline and 5 liters at room temperature.
Great, let's do our timeout and get this show on the road.
The surgical team proceeds with their timeout to confirm patient identification, surgical consent, surgical site, planned procedure, and appropriate images, if any, relevant to the procedure. The preoperative briefing engages all members of the surgical team, including the attending surgeon, in a short discussion before starting the surgical procedure. Individuals come together as a team, guided by a checklist, to discuss equipment, instruments, technology, lab, blood bank, intravenous infusions, personnel, radiographs, special precautions, patient disposition, and other needs for the procedure. The goal of this discussion is to establish all surgical team members on the same page of common understanding for the planned procedure from its inception.